Dermatology franchise. So I'll be your host this morning. Forgive me if I sound a little bit sleepy. I'll try to be as upbeat as possible. So again, welcome to the Transforming Lupus Care, partnering for better outcomes for Filipinos living with lupus. So this morning it will be a discussion focused on science, health, and innovation. So this morning, it's my honor to introduce our keynote speaker and also moderator. Dr. Juan Javier Lichauco obtained his medical degree from the University of Santo Tomas. He pursued his fellowship training in rheumatology at Montefiore Medical Center and Albert Einstein College of Medicine. He then joined St. Luke's Medical Center, where he would progress through several positions, including assistant professor at St. Luke's Medical Center College of Medicine, is or was the past chair of the Department of Medicine at the same institution, and he is currently the section chief of the section of rheumatology at St. Luke's Medical Center and was the past president of the Philippine Rheumatology Association. Let's give a warm welcome to Dr. Juan Javier Lichauco.
Thank you, Dr. Louie, and magandang umaga po sa inyo lahat. I'm Dr. Juan Javier Lichauco. I'm a practicing rheumatologist, but you can call me Dr. John Lee. It is my pleasure to welcome all of you to this important event. For the title, which is for this program, Transforming Lupus Care, Partnering for Better Outcomes for Filipinos Living with Lupus. Thank you for joining us today, and as we shed light in this very important condition that is often underappreciated and underdiagnosed, it is very important that we realize that this condition affects thousands of Filipino patients, and this is an avenue by which you can understand this condition today. This gathering could not be more timely because there are two important events that we are celebrating this month. First is May 10, which is the World Lupus Day, and this is a global call to action to again remind ourselves about the importance of this important condition. We must remember that 9 out of 10 patients with lupus are females. This is a female preponderant disease, and we are also celebrating over this weekend Mother's Day. And therefore it is important for us again to remind ourselves about the importance of protecting the welfare of our female patients with lupus and also empowering them because they are very important people in our lives, whether they are our mothers, wives, children, and our friends. So, to further discuss, I think that we'd like to mention that there are very important key stakeholders that have been very important part in the care of our lupus patients. And they have been our partners for the very longest time, and they are very much well represented here. We have, of course, the Philippine Rheumatology Association, the Hope for Lupus Foundation, the Lupus Foundation of the Philippines, and the Luisa. And we'd like to also remind ourselves that we thank everyone here. You are all important stakeholders in care of the lupus patient, whether you are a healthcare advocate, a researcher, a clinician, or a friend from the pharmaceutical industry. All of you play a very important role in the care of the lupus patient. So with that, and before we proceed with the panel discussion, I would like to first present to you important slides to give you an overview about lupus and the importance of why we need to discuss this important condition today. So I'd like to start by describing the condition. Lupus is an autoimmune disease that causes inflammation of multiple organ systems. So I'd like to first describe to you what this condition is. Because lupus is, if you were to have an analogy, you talk about cars, you think about, for example, a brand like Toyota, very common. And we talk about an autoimmune condition, the first thing that comes into mind is a condition called lupus. So lupus is a problem, it's a condition that is caused by a problem with the immune system, where the immune system is hyperactive or too much awake. And because an overdriven immune system is also bad, because that causes a condition where the immune system attacks different organ systems of the body, creating 24-hour inflammation. So lupus is an inflammatory condition, and it is challenging because practically any organ system can be affected by lupus. So I've shown you here pictures about patients presenting with different organ system manifestations. They always say that no two lupus patients are alike, and that they have a myriad presentations that make it often difficult to diagnose. We'd like to emphasize that there are some patients, up to 74%, that can have moderate to severe disease. And so when we talk about bad disease, we can have someone with very, let's say, skin condition, rashes, but that can involve a good number or surface area of the body. And we can also have bad disease because lupus can affect major organ systems such as your kidneys, and that can lead to end-stage renal disease or renal failure if patients are not treated adequately. Next slide, please. So there are quite a number of challenges that lupus patients face. We know that there is a delay in the diagnosis of lupus. From the onset of symptoms, it usually takes up to 3 to 7 years before the diagnosis is made. And one of the main reasons is that people are not aware about the condition. It's not a very common condition. Number two is that there's a delay because there are few number of specialists or rheumatologists that can diagnose this condition compared to the population. So to give you an example, there are only 270 rheumatologists that take care of 118 million Filipinos. Second, in this particular study or survey abroad, in Europe, you could see that less than 50% of patients in Europe had access to a multidisciplinary team. Remember that lupus is multi-organ, and sometimes we need help to take care of these patients with other specialists. And sometimes there is lack of access to reach all of these specialists to take care of the lupus patient. And lastly, 25% of patients feel that their doctor had not communicated with them sufficiently that the negative effects of steroids can affect their organ system. And I will discuss this a bit later on, but when we talk about side effects or damage to lupus, sometimes it's not just caused by the disease, but also from the side effects of our medications. Next slide, please. So in this Global World Lupus Federation survey report, I just wanted to highlight to you that in this survey, up to 89% of respondents said that they had damage from end organ damage. No? So we just really explain to you that in lupus, we talk about inflammation. So think about if you have a wound or a cut, it bleeds and then it becomes red because there's inflammation. But at the end of the process, you have scarring of tissue, right? Kapag scar na, that is permanent and that is irreversible. So when you have inflammation in lupus that is not adequately treated, you end up with scar. And an organ that is scarred cannot function anymore. So that's basically the basic template for us to understand why we need to diagnose and treat lupus early. And so the slide shows that majority of patients have end organ damage, and when you have more damage, that is equivalent to more morbidity and mortality and greater hospitalization. But in the left lower hand of this graph, you could see that up to 25% of patients can have damage as a result of medications. Next slide. So, if you are aware, I think that the first line treatment for lupus is the use of steroids. And steroids are easy to purchase. It is good if used properly, it is really meant for short-term use. It is very reliable and it works fast to control the inflammation, but we end up with problems when we give steroids or use it long-term. The problem here in the Philippines is that many patients cannot afford our better treatments, and so they end up using steroids as maintenance treatment, and that's where the problem comes about. Okay? So, in this particular survey that included more than 7,000 patients living with lupus from at least 108 countries, not only in Asia, we could see that 91% of survey respondents said that they are either currently taking steroids or have taken steroids in the past. So 6 in 10 reported at least one major side effect. And we know that when you use steroids for a long time, you can develop heart disease, diabetes, cataract, osteoporotic fractures, infections, to name just a few. So steroids are not pleasant medications taken long term. And in this survey again, 7 in 10 respondents were taking steroids for more than 5 years, and that's a very, very long time. This is a study, again, that looked into what are the barriers in giving appropriate lupus care, and this was a study among patients in Latin America, Middle East, and Asia Pacific. So let's start with the barriers. In terms of diagnosis, there is a problem about early diagnosis and referral, mainly because, like in our country, there are only a few rheumatologists and we have a lot of patients, and sometimes access to early referral is a hindrance. Second, and this is true, limited diagnostic exams. We need certain tests to be able to confirm the diagnosis. And when we did a certain caravan program where we met with certain specialists and primary care physicians in Palawan, this is something that is important, not only in Palawan, but I think in other rural areas, lack of diagnostic tests. So they don't have the tests available to help confirm the diagnosis of lupus. Second is about barriers on receiving lupus treatment. We need to have a good multidisciplinary team to take care of a patient. So if a patient has kidney problems, the rheumatologist is there as a primary doctor, but we need the help of the nephrologist for a good coordinated care. And oftentimes, we don't have that available here, especially in the rural areas. There is poor treatment adherence to medications, and the main factors that cause it is there are side effects. Sometimes they don't work. We still do have an unmet need about providing a good number of available options to treat each particular lupus patient. And there are quite a number who don't respond to our available treatments. Poor education and communication are so important because patients who have a lower level of socioeconomic status and do not understand their disease also have poor compliance with their treatments. Comorbidities, I think that we need to also not treat the lupus per se, but also address the comorbid conditions such as, what we said, kidney disease or other side effects from treatment such as osteoporosis or cataracts. And the last set of barriers is about treatment access. So we have problems about availability. We have available treatment options that have improved the lives of our patients. But these medications are expensive, and we must realize that we do not treat a lupus patient like an antibiotic for pneumonia that you just give it for 2 weeks. This is lifelong treatment that needs to be sustained. And so one important barrier is that our patients need to pay out of pocket. It's not reimbursed. And so that's the main problem. We don't have enough of adequate tools that are easy to use to be able to monitor our response to treatment. And essentially, most patients are on steroids, and therefore it's difficult to achieve steroid-sparing strategies. So some key things about unmet needs in lupus, and this is from a survey of 1,300 patients from the United States. So again, poor awareness, we talked about delay in diagnosis, but I just wanted to focus on the second part, which is lack of understanding the impact of lupus on the person's quality of life. So we talked about cost of the illness. When we talk about direct cost, it's about the expense of the medications, the follow-up, but we need to also talk about indirect cost. And so time lost from work is also an important aspect that we need to also be aware of. And also, there are some intangible, we cannot see certain manifestations of lupus. When you have active lupus, you have fatigue. And therefore, if you have fatigue, you cannot work. And it's sometimes very frustrating when employers cannot understand that these patients cannot work because of certain intangible symptoms of lupus. Next is about inequalities in access to healthcare, and this is already in the United States. We know that the healthcare there is also a bit problematic, and therefore you could see that 51% report about long waiting times to see a specialist, and this is a developed country. We also talk about 31% now paying out of pocket for their treatments, and 30% reported there were not enough doctors nearby to treat lupus. So sometimes the waiting time is really very long. So this is towards the end of my presentation, and just wanted to talk about this patient charter to improve care for lupus patients. And this charter outlines principles of quality care that all lupus patients deserve. So this charter or formal document was recently published in a reputable journal. And to just give you an overview, this charter was developed from a working group committee that was comprised of patients, patient advocacy groups, and healthcare professionals. And so what they did was they did an extensive review of the literature, looked also into best practices to come up with what were the most important global unmet needs of lupus patients. And from identifying those unmet needs, they were able to identify or develop 4 important principles. And these principles basically represented what is the minimum standard of care that every lupus patient should receive. And from that, they were able to develop recommendations about what are the important aspects that we need to develop to be able to address those unmet needs. So, principle 1, I deserve recognition and understanding of early symptoms of lupus to drive timely, accurate diagnosis and assessment so that I can receive the best care available as soon as possible. And ways by which we could address this particular unmet need is by improving education of the public, patient, and primary care doctors. Because the primary care doctors are the ones that normally will see the lupus patient first. So they need to be aware about this condition. Principle 2, I deserve access to information about my lupus so I can play an active role in the management of my condition, minimize flares, and reduce the impact of lupus in my life. And so we talked about improving access to patient information. And we also do now in the digital age have certain apps that we need to look at that maybe these are self-help care tools that patients can use at home to be able to monitor or track the disease in itself. Third principle is I deserve access to a coordinated multidisciplinary care team who fully understands my condition and my experience regardless of who I am or where I live. And so recommendation is to be able to ensure that multidisciplinary care teams are available. And I think I like this particular statement about personalized care. Each patient is individual, is unique, and we need to customize the particular care for each individual lupus patient. And principle 4, I deserve access to appropriate and comprehensive pharmacological and non-pharmacologic care which reduces the burden of lupus and allows me to have a high quality of life for as long as possible. And so avenues here is that we encourage patients to participate voluntarily in certain clinical trials that are testing new and upcoming treatment options, and also minimize or monitor corticoid use and update and actually utilize or implement present clinical guidelines. So this is my last two slides to just emphasize that we want to empower patients with lupus to understand their disease and take charge of their condition. And lastly, this is May, which is Lupus Awareness Month, and we always want to emphasize that we don't want any lupus to be left behind, and that we can all, with a concerted effort, make a better life for our patients. Thank you very much.
Thank you.